Testing, testing, testing. Sound test, sound test. Testing, testing, sound check. Testing, testing, sound check. Okay, everything looks good. Okay, good morning. Today is Saturday. What time it is? Yeah, right. Today is Saturday, September 24th, 2022. Today is our regular Saturday morning yoga therapy class. We have been teaching this class for years and years in person, and during pandemic it became virtual, and we're still continuing virtual. All of our practices here are based on our experience. We have thousands of people who have participated in our program with a wonderful outcome, with a disease-free, medication-free, and a quality lifestyle. Today's topic is yoga therapy harnessing prana. Again, this was a request. I had a request from one of our viewers to explain the yogic concept of prana, teja, and ojas, and how the prana in the pranayama is the basic ingredient of our healing. Metaphorically, if you think yoga therapy is a pill, the pill itself is the asanas. The active ingredient is pranayama, and the mechanism of action is your meditation, which acts in your emotional brain called limbic system, amygdala, hippocampus, connecting through hypothalamus, pituitary adrenal axis, causes psychoneuroendocrinology, and also correct altered hormonal homeostasis. So prana is a concept, and we have in every culture, every religion, every part in the world. From the Western medical standpoint, we cannot measure prana. It is a non-measurable, subtle energy. It's an energy, and breath is the carrier of the prana. Breath is not the prana. Again, metaphorically, prana is like an electricity and breath is like electric cable. And after a little introduction, I'm going to do the pranayama practices to show you how to harness the prana. Prana is everywhere, but the pranic healing is organ specific. Prana goes to the organ of healing and does the healing for us. It is called a Pranic Healing, Pranic Energizing Technique, and we'll show you how to do them. Fourth limb of the 8 limb of yoga practice is called Pranayama. Pranayama means Pranayama. Yama means control, restrain, expand. That means you are harnessing the prana and able to have a control over prana to take it to the organ of healing. And how you do it? That's a practice I'm going to show you through the breathing practices called pranayama and the hand gestures called mudras. So when you look at this concept of prana, this concept of prana is in every culture, every religion, every society. Chinese call it a chi, Greek calls it a pneuma, and it's all connected to the breath. Pneuma means breath. Remember, the word and this practice is also called a spiritual practice. The word spiritual comes from the root Latin word called spiratus. And we all physicians, we know, because when you do a pulmonary function test, we call it a spirometry. And spiratus means your breath. The spiritual connection between you and me is through the breath. God made us from a clay or from a dust. And what God did, put a breath in our body to be alive. What are the traditions? You name a tradition. Every tradition has a name. Okay. Latin is called enema. Sufi culture call it a ru. Hebrew also call it a ru. It's a different spelling, but ru. Mayan culture call it mana. Our Native Americans have, they call it a something with the O, I think Orienda or Orenda. You can check it out, because as I said. So let's start with our pranayama practice. The concept in yoga is that the health is defined as, first, strong digestion, easy elimination, and good night's sleep. We learned it from the babies. A healthy baby eat, poop, and sleep. If you have all these functions as a normal, you are healthy. In yoga and Ayurvedic tradition, health is also defined as a prana is flowing, teja is glowing, and oja is building. Prana flows through the channel called nadis. The nadis get blocked with a toxic substance called ama, which is an undigested food material. And when the channels are blocked, prana cannot flow and we develop the disease. As simple as it is. When your mind quiets down, prana flows properly through the channel to the organ of healing. So in the state of meditation or in the state of relaxation, you can guide your prana to the organ of healing. So the first concept, breath is the carrier of the prana. Breath has to be effortless. For an effortless breathing practice, you need the relaxation of the muscles of respiration and the accessory muscles of respiration. There is accessory muscles of respiration, sternocleidomastoid, trapezius, and the main muscles of respiration is pectoralis, latissimus dorsi. So the first practice for you is a asana practice, and asana is your relaxation response. The first relaxation is your hands. When the hands gets tied up, you get very tense. So if you look at a baby will close their hand with thumb inside and close. Thumb inside and close. This is called Balo Mushti Mudra. It will relax your hands and get rid of all the pains and ailments you have in your hand. Remember, pain comes from the tightness. It is not your arthritis, not the damage of your cartilage, because cartilage has no pain fibers. When your hand is relaxed, your fingers are separated. If you put your fingers, it goes like this. You can turn your hand. It is very nice and relaxing posture. You can do it with breathing. Put your hands in the front. Breathe out first. Take a deep breath in. And breathe out and close your hand like a Balo Mushti Mudra, baby fist, or else called Adi Mudra. You can do the eyes closed. Close your eyes. Take a deep breath in and breathe out and close it. In yoga practice, you always breathe out first. Keep doing it a few more times and let me explain to you why. Lung is like a balloon. It has a 6-liter capacity. It needs 1.5 liter to stay open. 4.5 liters of air can be exchanged. That is called vital capacity. Normally we exchange only 500 cc. Wrist gets relaxed with the flexion, with extension. So you put your hand like this. Breathe out first. Take a deep breath in and breathe out. Breathe in, breathe out. All the practices we do with our eyes closed, breathe in, breathe out. When you do your eyes closed, you access your subtle body. With your eyes closed, you don't know who is doing what. When in a group practice, you are following, listening to your body. In a yoga therapy, you don't compete. You start where you are. All the muscles, all the shoulder joint, elbow, wrist, everything gets relaxed. Every organ, every joint gets relaxed when you do a Paschim Namaskar, prayer pose to the back. And let me show you slowly, and if you want to do it, you can do it with me. And first of all, you have to remember you have to sit down with your spine straight. Once your spine is straight, let me show you a little bit. See, I have this chair, I'm sure many of you have seen. This is called a kneeling stool. When you sit down in a kneeling stool, you always keep your spine straight. So, in a computer, this is the way I do your keyboard. This is my monitor. I'm looking straight at the monitor. I'm not hunchback. I'm not doing like this. This hunchback is killing us. Even if you're in a chair, so if I do in a chair, I would sit down in a chair all the way to the back, keep my spine straight. So, let's slowly do it one step at a time. I'm sure there is some new people. There are some new people always. You can take your hands to the back. If you can see me better, you can take your hands wherever you are. If you can put your hands together, better. Close your eyes and do yogic breathing. Breathe out first. Take a deep breath in without any effort. And breathe out longer than breathing in. Slowly put your hands in a prayer pose and stay here. Do not cross the limit of your pain. If you have a pain, you back off. If you don't have any pain, you stay here. Stay here between 5 to 10 breathing cycles. If you keep doing the practice, a habit will form, which in medical term called a neuroplasticity. And in a neuroplasticity, you will be able to do it more and more. It takes, from different people, different time, 10, 20, 30, 40 inputs for the neuroplasticity. Once the neuroplasticity sets in, your hand will go a little higher. 1 month, 6 months, 10 months. You see, yes, you guys can see it. Okay? And slowly, you will come to a posture in an asana practice, which is called Sthiram Sukham Asana. So I'm keeping my hands in the back. I'm not moving around. So just turn my chair so you will know what I mean. My hand is to the back. This is the asana called Sthiram, stillness, Sukham, happiness. Asana is a pose. A therapeutic asana is a Sthiram, Sukham asana. Next practice is to harness the prana, is to quiet down your mind. 2 terms for yoga therapy called Merudanda Achal, means keeping your spine straight. This is keeping my spine straight. I'm sitting with my complete straightening of my spine. Then it's called a manasthir, stillness of the mind. Our brain, our body, essentially in our mind, is in a state of vibration. create another vibration. When the two vibration interacts, it creates a phenomena called harmonic resonance. The vibration gets cancelled, your mind quiets down. That is the basic principle of mantra. Mantra in yogic tradition is a vibration. The wordings has a meaning. Gayatri mantra, Om Bhur Bhuvaswa Tat Savitur Varendam Bhargo Devasya Dhimahi Dhiyo Yona Prachodaya. Wording has a profound meaning, but it's a vibration. The way you pronounce that quiets down your mind. Yogic practice, it is called a Brahmri Pranayam. It is called a bumblebee breathing. What you do, let me do a bumblebee breathing first, Brahmri Pranayam. Then we'll incorporate the Brahmri Pranayam with the Brahma Mudra, relaxation of your neck with Paschim Namaskar, the prayer pose to the back. Mind in yoga is described as the content of your five senses. I hear, I see, I smell, I taste, and I touch. And most important, sense is your vision. Because eye is the brain outside your skull. Eye is the mind of your body. So you shut down the five senses, you create a vibration which is a sound of a bumblebee to quiet down your mind. So put your two index finger in your third eye, use your other three fingers to close your eyes. You can use your thumb to close your ear and close your mouth. You will breathe out first. You will take a deep breath in and you breathe out sound of a bumblebee. Breathe out first. Take a deep breath in. One more time. Breathe out first. Take a deep breath in. Follow this with the called pumping and cupping. Keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Take both the hands like a cup Put it over your eyes. Let the eyes take all the heat from your hand. Heat relaxes your eyes, relaxes your ciliary muscles, it relaxes the 4 cranial nerves. Eye is supplied by optic nerve. 2 muscles have an individual cranial nerve called SO4, LR6. Superior oblique is supplied by 4th cranial nerve, and lateral rectus is supplied by the 6th cranial nerve. Then you have a branch of the trigeminal nerve, 5th cranial nerve, coming through your eyes and the surrounding areas. It increases the convexity of your lens. You don't need a reading glasses to read. Massage your forehead slowly. Massage your eyes, massage your face. All the muscles here in the face is attached to your skin. Relaxation of the muscles will remove all the lines, all the frownings, all the wrinkles. Take your hand, massage the ear. In the earlobe, behind the ear, in front of the ear, inside the ear canal. There is a nerve called the auricular branch of vagus nerve. It's called vagus activation, parasympathetic activation, and relaxation response. Bring the hand down, massage the side of the neck. It's called carotid sinuses. Massaging the carotid sinuses quiets down your cardiovascular system, neurological system. You're in a profound level of relaxation. Hands to the back, massage at the level of occipital tubercle down. The 2 muscles are attached, sternomastoid muscle and trapezius muscle. Both are supplied by cranial nerve. See, people have a wrong concept about the practice of yoga. People think, yoga practice means you need to put your body in the shape of a pretzel and, oh, I'm not flexible enough. Flexibility has nothing to do with yoga therapy practice. Yoga therapy practice, you start where you are. In stages, impossible become possible. You achieve your therapeutic goal. See, we do all the time with our health tracker. Yeah, my one is being charged. The charge is a little low. Every day you have seen, I use my Apple Watch with my iPhone. Because at this time, if you measure my heart rate, measure my blood pressure, do an EKG, all of them will come down. I'm in a parasympathetic activation. I have a saliva in my mouth. My mouth is wet. I have not drank any water in a long time. When you're in a sympathetic overdrive, your mouth gets dry. So now, let's incorporate relaxation of the neck muscles, which are called accessory muscles of respiration. Paschim Namaskar, hand to the back in the prayer pose, slowly and slowly relaxes the muscles of the respiration. Remember one thing, initially the muscle will contract to take you to the position where you want to be in the asana practice based on your own body's warning signal. 2 warning signals you have to look for. First is the pain. If you have a pain, you created too much imbalance. Pain means pay attention. God gave us the pain for us to look in that place. Why am I in pain? Effortless breathing. Effortless breathing is a yogic concept called Annamaya Kosha to Pranamaya Kosha. Any imbalance you create in the physical body, it will show up in your breath. You will see, you'll sit down in a chair, keep on turning, just doing a little twisting of your spine. You'll see a certain point will come, you will be able to see your breath gets into an effort. Don't go that far. In the posture when you are in, you will be able to talk, you will be able to sing. That's a therapeutic yoga practice. 4 postures of the neck to relax. Again, when the muscle contracts, it takes you to the position like here, my hands to the back. Muscle cannot stay contracted too long. If you stay in the posture, muscle starts to relax. Before the muscle completely relaxes, it causes a little fasciculation, contraction, which causes a little bit of shaking, sthiti, stillness. Finally, the profound relaxation. It's called arambho in asana, called at the beginning. Then it's called sthiti, stillness. Then is a profound relaxation, it's called a visarjan. Arambho, sthiti, visarjan. 3 Sanskrit terms for the stages of the asanas. You breathe out first. Take a slow, deep breath and put your head to the back. And breathe out with the sound of a bumblebee. Your eyes are closed. Your eyes are closed. When your eyes closed, you access your subtle body. You have 3 bodies: gross body, sthula sharir, subtle body called shukha sharir, and causal body is called karana sharir. The moment you close your eyes, you access your subtle body, and prana literally flows through the channels or the nadis of your subtle body. You drop your head to both sides with the same inhalation and exhalation with the sound of a bumblebee. Breathe out first. Deep breath in. Look all the way to the back without turning your shoulder. Same breathing concept, same breathing, effortless breathing, able to talk, able to sing, and able to put your hands to the back. If you see, my hand is still there in my back. I've not moved any at all. My hand is still there in my prayer pose. And you get to the state slowly and slowly through the phenomena of neuroplasticity. You do the other side too, and then you slowly rotate your neck to the left, to the back, to the right. Drop your head down, breathe out first. Good deep breath in. When you quiet down your mind, prana started flowing to the organ of healing. In a pranayama practice, first you want to energize the prana and increase the amount of prana in your body. Prana is your healing substance. The first pranayama is called Bhastrika, bellows. So when you do the bellows breathing, if you do bellows breathing, you bring more prana in your body and mind. In a Bhastrika pranayama, it is the active inhalation and active exhalation. In a normal breathing, it is the inhalation is active, exhalation is passive. Since the lung is a balloon, we practice a longer exhalation. Longer exhalation is also parasympathetic and inhalation is sympathetic. So what we do in a Bhastrika called bellows, bellows is the pump. You use it for your fireplace, the blacksmith uses it, you use your lung like a bellows. Bhastrika. So normally you will see, I'll be doing a breathe out or breathe in. I'll do it slowly I do it fast. People always ask me, you have to do it slow to get the proper achievement, and pranayama you always talk about you have to do under guidance because a wrong pranayama will be more hurtful. In a pranayama practice, you practice it as if it's a normal breathing. There is no effort involved in it. And it's a balancing practice. Balancing practice means, say, if I'm doing it, inhalation, breathe in and breathe out. Next one I will do opposite. Breathe in, breathe out. And the eyes closed, I can go a little faster. Speed has nothing to do with it. What it is, what I'm doing now. I'll be able to talk, I'll be able to sing. All my residual dirty air has been washed out. Now if I breathe out, take a deep breath in. I'll be able to breathe maybe 2 times, 3 times, 4 times the normal breathing cycle. We also practice this with asanas. I will do sit-ups in the morning with Bhastrika Pranayama. I'll show it to you. You will think that it's not difficult, but there's a profound therapeutic effect. You can do the hand raised. Raise your hand, breathe out, and slowly pull it down with your yogic fist. Bala Mushti Mudra. Breathe in, breathe out. Keep doing it. You'll feel the effect of it. Long inhalation, longer exhalation. Yoga therapy is the art of transformation. It transforms a rogi, people with disease, with a nirogi, people with no disease are healthy, to a yogi or yogini who is in a proper health, proper balance of the body, mind and spirit, who is enjoying this quality of life. You can start a little slow practice, then you do a medium speed, then you go to rapid speed. Generally we do for our practice, we do 20 counts each, 20 slow, 20 medium, 20 fast, 1 cycle, and you keep repeating the cycle. 1 cycle, 2 cycle, 3 cycle, 4 cycle. Generally we practice with the effortless breathing. People ask me, how long, why, what? I said, it is your body, your mind. Listen to your bodies. So let me show you the one sample. And I'm showing you a gradual progression of a Bhastrika Pranayama. And also remember, it improves your lung function. And simple concept, people who are dying, we call it expired. Last breath come out. When the lung stops, heart stops. Heart stops, brain stops. When the brain stops, all the cellular function stops and we die. Improve your lung function, improve your heart function, improve your brain function, improve your cellular function. So that cell in the pancreas, the beta cell, which was not producing enough insulin, with the practice of the pranayama, probably will be increasing the insulin and probably maybe it's helpful for your diabetes. So hand goes high up, slowly. Breathe in. did 20 of them in slow speed. I'm still talking. I'm totally in effortless breath, as if it is my normal breathing cycle. Medium speed, we call it Soham. Till the medium speed the same way. And at 20 medium speed, I'm talking, I'm breathing, totally effortless. Generally in the morning, for our daily dinocharya, daily routine, we brush our teeth, scrape our tongue and jal neti. Wash our nose are all open and clean, but you do have some drainage throughout the whole day because some water stays in your sinuses. In a rapid Bastrika, it's called a Vishnu, do like this. I did 20. I've been doing it so long, I can keep on doing it for a long period of time. But we make it as a structured Bastrika Pranayama to improve your prana. This is called a Pranapruthan Pranayama. It brings prana in your body. You can do it sitting down and in a very slow to the fast without raising your hands high up. We do it in thousands, in hundreds, but completely effortless practice. Daily practice is 1 hour of yoga therapy practice, 25 minutes of asanas, 25 minutes of pranayama, 10 minutes of meditation. I'm having saliva in my mouth. I can feel it. So the rapid pranayama practice will be, or a practice, Bastrika practice will be like this. For the sake of time, I just did 200. I generally do 500, 600, maybe a little bit more, a little bit less. But what I'm watching, I want you to watch is that I'm still breathing. I'm still having effortless breathing and I'm talking. So now you brought the prana in your body, and then at the end when you do the practice, we'll be doing a practice called meditative alternate nostril breathing, where I'll show you how to guide the prana to the organ of healing. Now, the prana has to flow all the channels in your subtle body, called nadis. Main nadi is your three main channel. On the left side is called Ida, right side is called Pingala, which starts at the root of your spine. It comes as a crisscrossing on each chakra. We have 7 chakras, and it comes out to the left nostril as the Ida and right nostril as the Pingala. Left nostril is cooling. It is controlled by right brain. Right brain is intuitive, cooling, female, parasympathetic. Left nostril is cooling and parasympathetic. Pingala comes out to the right nostril. Right nostril is controlled by your left brain, which is male, which is heating, which is sympathetic. So it's completely opposite. Balance of these two nadis are in the center called Sushumna Nadi. And in a pranayama practice, your prana also ascends from the Muladhara chakra to the Sahasrara chakra. To keep the channels open, we do a pranayama first called Anulom Vilom Pranayam, alternate nostril breathing, to keep both the channels open, and then slowly open your middle channel called Sushumna Nadi. Then you do a practice with the breath holding with the alternate nostril breathing, which is called your Nadi Shuddhi Pranayam. Nadi is a channel, Shuddhi is a cleaning. It cleans up your channel so prana can flow very easily, and because of the other pranayama, which is called a Kapalbhati Pranayama, which will come next, or we will show you next. The Kapalbhati Pranayama is called the Pranapruthan Pranayama. Bastrika bellows was a Pranapruthan Pranayama. It brings the prana to our body. Kapalbhati Pranayama is the Pruthan Pranayama. It ignites your Agni. Jathar Agni. It improves your digestive fire. It converts your food into Saptadhatu, 7 tissue. Rashadhatu, Raktadhatu, Mamshadhatu, Medadhatu, Ostidhatu, Majjadhatu, Shukradhatu. With your digestive fire, it digests the ama, the toxins from undigested food. We do a pranayama, Kapalbhati Pranayama. The word comes from Kapal, means forehead, Bhati is called shining. It also ignites our Teja. Tejas is the fire within us, it's called a glow. When you do a pranayama practice, people will say you are glowing. It's like an aura around your face. And take a picture of, say, Jesus, picture of a Buddha, you'll see the aura around their face. And if you keep on doing it, people will come and say, you look young, you look so as if you were glowing. So Kapal is the forehead, Bhati is a shining. It looks like you are shining because of Tejas. We do a lot of mudras. Remember, the mudras are also harnessing prana. Mudra is a hand gesture. Hand is a connector between your body and mind. Mudras are psychophysical connector. That means it connects your body and mind, psychophysical connector to guide the prana to the organ of healing. So if you look at these mudras, If you touch index finger and thumb, this is your Gano Mudra or Dhanu Mudra. It's a meditation mudra. It guides your prana to the organ of healing. Remember, meditation is the medication. We have shown you so many practices. If you're with me for a long time, you know exactly the practices we do. So it is called meditation mudra. Dhanu Mudra, Gana Mudra. If you take your index finger down and put your thumb high up, this is called your Vayu Mudra. It tames, quiets down your Vata energy, which is a mobile energy which is responsible for pain, controls your pain. Here prana is going to the organ where there is a pain and relieves your pain. Shunya Mudra, middle finger and thumb. Here you are guiding the prana to the organ of hearing, improves your hearing. It is your Akash, Vayu, Agni, Jal, Prithvi. Space, air, fire, water, earth. It's the space and the fire improves your hearing. Ring finger and thumb is called your Prithvi Mudra. It tames your kapha energy. Very good for truncal obesity. Very good for your diabetes. We do a Kapalbhati Pranayama with each mudra. If you practice it with me before, you know, we do 20 to 50 Kapalbhati Pranayama with each mudra. Little finger and thumb, it takes you to your water content in the body and primarily to your bladder and the skin. If you have a urinary bladder dysfunction, incontinence, stress incontinence, especially for women after childbirth, they will have a little stress, little coughing, sneezing, and they'll have incontinence, urine will come out. Do the Kapalbhati Pranayama with the Varun Mudra. It is also for your men with a prostate problem. Touch your ring finger, little finger and thumb. Shakti Mudra. The word Shakti means strength. Wake up in the morning, you don't feel, do a pranayama with Shakti Mudra. Middle finger, ring finger and thumb, it is called your Apna Mudra. It's Apna Vayu. There are 5 Vayus. Udana Vayu, Prana Vayu, Samana Vayu, Apana Vayu, Vayana Vayu. Connected to the 5 elements, Pancha Mahabhuta, space, air, fire, water, earth. Prana Vayu also have another 5 sub-Vayus. This is your digestion mudra, Pachan Mudra, downward force. It removes all the excess. It will digest your excess sugar, excess cholesterol, anything excess. If you put index finger down, this is called your Apna Vayu Mudra. This is called a Hriday Mudra. Here it guides the prana to the organ of healing, which is the heart. If you have a cardiovascular issue or a pulmonary issue, do your pranayama practice with Hriday Mudra or Apana Vayu Mudra. A lot of other mudras are there. They call it Linga Mudra. This improves your respiratory drainage. You know that the children with a little phlegma, they'll put their hands like this. Linga Mudra. Ganesh Mudra, remover of your obstacles. Hold your thumb, wrap your hands, touch your Shankha Mudra. Quiets down your mind. When your mind is restless, do Shankha Mudra. Touch your tip of the index finger, called a Hakini Mudra. It is your focus. Many a time when I'm talking to somebody, paying attention, my hand goes like this without knowing. That's your practice. And balancing both sides of the body is called a Dhanu Mudra. Opposing finger. Right index finger to the left middle finger. Right middle finger to the left index finger. Right ring finger to the left little finger. Right little finger to the left ring finger. Touch your thumb. This is like your udder of a cow. Dhanu Mudra. It balances both sides of the brain. So generally you start one mudra, Dhanu Mudra, Jnana Mudra, put there. You have one balloon here called abdomen, then have a diaphragm, then you have a chest, another balloon. You push this balloon. You bring your awareness to your belly button. Push your belly button to the back. Reduces the size of your abdominal content and it pushes the diaphragm high up. It is an active exhalation and passive inhalation. Eyes closed. In a full pranayama practice, we'll be doing the whole your Kapalbhati pranayama with all the mudras. We generally do the 50 with each mudras, but many a time people say, I cannot do it. I cannot do it. You can put your hand in the belly button, put your hand in the after nose, air will come out. So the people say, I cannot do it. I ask people to cough. I said, why did you cough? Now I said, why don't you cough with the mouth closed? It becomes a Kapalbhati Pranayama. Kapalbhati Pranayama is followed by, called your bandhas, Mula Bandh, Uddiyani Bandh and Jalandhar Bandh. In a Jalandhar Bandh, it's called bringing chin to your chest. It massages your carotid sinuses. You take a deep breath in and hold. And that is called Abhantarin Kumbhak, breath holding in inhalation. Then you incorporate chin is called your Murcha Pranayam. Murcha means unconscious. You feel so relaxed, you feel like you're unconscious. Essentially in a spiritual practice, pranayama, which is a voluntary regulated breathing, leads you to the cessation of respiration and in a state of eighth limb of yoga called samadhi, and essentially at the end is called Maha Samadhi. Maha Samadhi is when you're living this earth, we are in a transition. Breathe out first. Generally do a Dhanu Mudra, Jnana Mudra, put your knees. Take a deep breath, breathe out first. Slowly a long, slow breath in. Hold your breath. Drop your chin down close to your chest and keep holding your breath. wonderful practice. Holding your breath, the lung starts to expand, but cannot expand more than the rib cages. When it comes to the pleura, there is a fibers which then starts recoiling back your lung. It is called a herring brewer reflex. The fibers which starts recoiling, it is your vagus nerve. So you get a vagal activation, that's where you get a relaxation. That's where the prana is all guided. You do a Uddiyani Bandh, which is a breath holding and exhalation. Breathe out first. Take a deep breath in. Completely breathe out. Suck your stomach and hold. Always develop some cough, because cough comes from the larynx where all the pranayama practice starts. Uddiyani Bandh. Breath holding and exhalation, sucking the stomach in. It increases the negative intra-abdominal pressure. It causes proper perfusion of the organs. It is a wonderful practice. Mula Bandh. Sit down is called a Kegel maneuver. You contract your anal sphincter, then pull out the whole pelvic floor anal sphincter and hold it. When you do all things three together, it's called a Maha Bandh, three Bandh. Mula Bandh, the root lock, Uddiyani Bandh, abdominal lock, and a Jalandhar Bandh, chin lock. It guides your prana from all the 7 chakras. Muladhara chakra to Shadhisthana chakra to Manipur chakra to Anahata chakra to Vishuddha chakra to Agga chakra to Sahasra chakra. Energy, potential energy become kinetic energy. And this Sanskrit term is called Kundalini Jagaran. Serpentine. Kundalini means there is a snake which is sitting here, and you feel it. When you have a sudden, some unusual thing, you feel, we call it there is a snake going through my spine. To keep the channel open is called your alternate nostril breathing, Anulom Vilom Pranayama. Left hand is your again Dhyana Mudra, Gyana Mudra, right hand you close your right nostril. You don't have to close all the way, just a little bit underneath your nostril. Breathe out through your left nostril. Take a deep breath in through your left nostril. Close your left nostril with the ring finger and little finger and breathe out through your right nostril. Breathing out longer than breathing in. Again to the right nostril, there is a very slow, long, deep breath in. Close your right nostril, breathe out through left nostril. Keep doing it. As I said, left nostril is controlled by the right brain, which is cooling, parasympathetic, female. Left brain is controlling right side of the nostril, which is the male, hitting, sympathetic. It activates both sides of the brain. It is very good for people with hypertension, water-related disorder, and for neuropsychiatric disorders. Next, what you do, you bring a more concentration. You put your index finger and middle finger in the third eye. Close your eyes, bring your awareness third eyes, then take your left hand, hold on to your right earlobe. That is your called super brain yoga. It balances both sides of the brain. And keep doing alternate nostril breathing. You do it until you feel an effort in breathing. If there is no effort, we generally do between 5 to 10 minutes. 5 to 10 minutes of Kapalbhati Pranayama, 5 to 10 minutes of this Anulom Vilom Pranayama, about 3 to 5 minutes of Bhastrika Pranayama. This is called a Pranapruthan Pranayama. It balances your Vayu, the Vata energy, and it also opens up the channel called Nadi Shuddhi Pranayama, and it guides the prana to flow properly throughout your subtle body. In a Nadi Shuddhi Pranayama, you incorporate a little bit of called the breath holding. When you breathe in, inhalation is called Puraka in Sanskrit. When you inhale and hold the breath, it's called retention. Abhantarin Kumbhak. Kumbhak is breath holding. Abhantarin after inhalation. Exhalation is called Rechak. And breath holding after exhalation is called suspension. Bajya Kumbhak. Ratio is 1:4:2. 1 inhalation, 4 breath holding, 2 exhalation. If you do start with 4, 4, 16, 8, if you do 5, 20, 10, all depends upon, it has to be completely effortless practice. Use a mudra called a Vishnu Mudra. Bring your middle finger, index finger down and make a pinch with your little finger, ring finger and thumb. Put over your nostril. Close your right nostril. Breathe out through your left nostril and then breathe in with a count of 4 in. Sorry, excuse me. This happens because you do in the morning the jalneti. You clean your nostril, this is entirely normal. Vishnu Mudra, breathe out through left nostril, breathe in through left nostril with a 4. Hold your breath, count of 16. Breathe out through the right nostril with a count of 8. Generally we do the same, count back again, but I'm going to show you one more that since we have been doing it for a long time, let me show you the 5. Breathe out through the right nostril. Breathe in with a count of 5 in. Hold for the count of 20. Breathe out through left nostril to the count of 10. This is called Nadi Shuddhi Pranayama, channel cleansing. It cleanses the channel and also it improves whole digestion so that the food converts into 7 tissues, then it converts into a substance called ojas. Ojas is our body's immune system or immune organ. So the whole practice of harnessing prana is your Agni Deepana. Agni, that means you're the digestive fire inside you, you ignite, Agni Deepana. Ignite with your Kapalbhati Pranayama. Ama Pachana. Ama is the undigested food toxin which blocks our channel. So digest the ama pachana. Nadi shodhana. You cleanse your channel. Nadi shodhana. Then ojo sthapana. Ojo means your immunity. Sthapana is your establish and to increase. Essentially, yoga therapy practice for a chronic life-related disorders will be getting out of the disease. Dis-ease, in Sanskrit is called ashuk. Happiness when it's gone. Dis-ease. When ease becomes dis, it's a dis-ease. And an effortless ease is a therapy. Your blood pressure will come down, coronary arteries will open up. It is another different practice. I'll show it to you, yoga therapy for cardiovascular disorders. Finally, you guide the prana through a state of a meditative practice, which is called a Kebul Kumbhak. It is a breathing technique. And remember, in yogic practice, our whole body is doing the breathing. It's not only the lung. So touch your index finger and thumb. Sit down in a chair or can sit in the ground. Wherever you want to sit down. Sit in the ground in a proper meditative asana. Meditative asana is a Sukhasana, easy pose, Siddhasana, perfect pose, Ardha Padmasana, half lotus, Padmasana, lotus, or Vajrasana, thunderbolt, or sitting in a chair with the spine straight. You breathe out first. And slowly take a slow, long, deep breath in. Air is entering through your nostril. Air is getting filtered. You have all the hairs in the nose, and the nose is a filter for your inhaled air. Nose is a personal air conditioner. Outside air is warm, it will cool it down, and outside air is cool, it will warm it up. Air goes to the side of the nostril where there is a channel called turbinate. Turbinate converts this air flow into a vortex. The vortex goes over the mucous membrane of the sinuses, and the mucous membrane releases a substance called a nitric oxide. Nitric oxide is a potent vasodilator. It opens up the blood vessel. It maintains your endothelial health. Endothelial health today is the health of our body and mind. Nitric oxide is also a mediator of parasympathetic tone. Parasympathetic tone is mediated by nitric oxide, acetylcholine, cyclic GMP. Visualize the air is going behind your throat, upper part of the lung, middle part of the lung, lower part of the lung, almost to the level of your belly button. Hold the breath for a short time, which is called a kumbhak, cable kumbhak. Visualize air is coming the lower part of the lung. In the meantime, air has done all the exchanges from the blood vessel of the alveoli of the lung. The fresh oxygen went into the blood, and the carbon dioxide came from your blood, all the waste material. Comes to the middle part of the lung, upper part of the lung, behind your throat, coming out through your nostril. By analyzing your out breath, we are able to diagnose almost 450 diseases today. Prana is in subtle energy which resides outside your nostril. Visualize your breath is picking up the prana. Prana, visualize prana is going through your inhale air like an electric cable, through your nostril, behind your throat, upper, middle, lower part of the lung, then is going to the organ of healing. I have a heart problem. I had a triple vessel coronary bypass surgery about 21 years back. I'm visualizing the prana coming to my heart. People have a back pain, you visualize prana coming through your back. If you have hip pain, knee pain, you visualize prana coming to the organ of healing. If you have a diabetes, you visualize prana is coming to the pancreas. This prana, through the practice of pranayama, control, restrain your prana through the mudras, psycho-physical connector of guiding mudras to the organ of healing. You get a pranic healing, you harness the prana, prana flows through the whole body without any obstruction. Obstruction of the prana is a disease. Free flow of prana is your health. With this practice, you will be a different person. You will have a transformation from rogi, from disease, to nirogi, no disease, to yogi, a balanced person enjoying good quality life. You can bring your hands in front of your heart chakra, touch your little finger and thumb, separate your ring finger, middle finger and index finger. Padma Mudra, Lotus Mudra. This connects your body, mind and spirit. Slowly bring it to the site of your heart. Heart is the site of your soul. When you do this practice, when you do the harnessing prana, when you bring the prana to the organ of healing, you get a physical wellness, mental wellness, spiritual wellness. Wonderful practice. Put your hands in front of you, bow your head down, you say, Namaste, I honor the divinity within you. You are divine, I'm honoring it, I'm respecting it, and I am achieving a full health by this daily practice. This is the practice, primarily it is a pranayama practice with the mudras for your pranic healing. Pranic energizing technique. Lot of things are there which have been described in our scriptures. So, what is going on now? White House has declared that we are pandemic free. We have entered from pandemic to the endemic state. So we started accepting the presentations outside. I've already been to Texas for an in-person presentation. I was in New Jersey for in-person presentations. So we have a lot of yogic presentation, socio-cultural presentations. So we are getting slowly and slowly active as if it is in our endemic phase. So as I said to you, for the last how many years? We're doing 15, 20 years, been practicing. If I am in town, if I'm free, I will be doing this virtual practice unless somebody in the town sets up a place for in-person presentation. I'll be glad to do it also. I know for sure next couple of weekends I'm going to be out of town, so there will be probably no classes. Maybe after the third weekend I'm going to have a teaching, whole weekend teaching for the yoga teachers training, advanced yoga teachers training, the Ayurvedic yoga therapy, which I will incorporate this class with the teaching. So probably we'll see you in 2 to 3 weeks. And in the meantime, this will be all uploaded to YouTube. You go to my YouTube channel, and any questions you have, any comments you have, please share with me through the Facebook. I am not that good doing Facebook, but whenever I come see, I'll be glad to answer for you. Thank you for joining. Probably see you in a couple of weeks.